So we're talking about relationships. We keep talking about this. We're going to keep talking about this over and over again because it's what's important, right?
Yeah.
But in your mind, a couple things that make practices good, bad. Any.
I think what makes a good practice, of course, it starts with the provider, but it's the whole. It's everyone. It's from the person who answers the phone, office manager, clinical staff, and whatnot. I've had one of the ways to really make your office a positive environment is to hire the right people who are happy doing what they're doing, taking pride. And I think patients can tell that. And it's all about communication. And if there are certain, I'm really big on Medicaid. I always tell patients, picking primary or any other office, do not go to any office which does not take Medicaid. I'm big on that because
That's a great point.
I grew up in public housing. Until I went into military, I had never been to a dentist, and I never seen a doctor until I went to Naval Academy, where I remember seeing a dentist for the first time. He goes, "Hey, Chun, you have all these cavities. When's the last time you saw a dentist?" I've never seen one, doctor. You never seen a dentist? No. I told him I'm an immigrant, and a doctor too. I've never seen a doctor. So from that environment, for me not to take Medicaid, it makes no sense.
Yep.
But there are offices which do not take Medicaid. And the question is, why doesn't a practice take Medicaid? Because it's financially driven, right? Because Medicaid does not pay as much. But when an office has such socioeconomic bias, they will have other bias. So in my mind, it's a simple rule. If an office doesn't take Medicaid, then don't pick that one. Go somewhere else. But aside from that, there are a few things I think which common for a quote-unquote bad office. When patient's time is not respected, like long waiting time, or the last-minute cancellation, or not returning phone calls. If a patient is having to call back more than once for a lab result, for example, those are typical red flags. But the problem is, this is a problem, at least in OBGYN. A lot of patients don't complain, at least not to the office.
Yeah.
They complain to their girlfriends, their mother, their other peers. And because of that, no major change takes place. And I know plenty OBGYN office where they don't really have to correct their behavior because patients still show up. But if one were to pick a brand new office, I think we really have to do a little homework. And I said before for pediatric office, most pediatric providers and offices I give solid B. B is a good grade. It's not A, but it's not C. It's a good grade, right? I don't know of any really bad pediatric office. Of course, you have the best office.
No, I don't know if I do have that, but I want to have the best office,
Yeah.
and that's and you just summarized stuff beautifully. I think that there's so many little nuances, and like one thing about my office and how any office is, you just want to do better.
Yeah.
I want to be the best.
Yeah.
Like and I think that my office is our goal is to be better every day. I don't want to. Sometimes you can look at what your work you do as like a money market account, right? You just kind of grow slowly, and you're happy, and you don't have to put too much into it. You'll get what you want out of it. I want a supercharged mutual fund, or
Yeah.
I want a Bitcoin, right? I want to not financially, but what we get out of what our patients get out of it. Like I want our practice to always do better. And it's interesting. I was actually calling a specialist office today for my mother. I had to make a appointment for her, and when the secretary answered the phone, she said, X practice, can you hold please? Doop.
I really
and I was on hold for 5 minutes, and I whatever, and I came back. I had to do some work, and I came back again. I had it on speakerphone, and I did it again. And thank you for calling X Next Practice. Can you hold, please? And I said, beep, put me on hold again. And I had it on speakerphone, and my other providers were with me, and they were like, "Is that for real?" I said, "Yeah." I said, if that happened at our office,
Yeah.
I'd be out there in a second in reading the riot act, because like that is so unacceptable and not appropriate.
But the thing is, many patients don't complain, and that is so wrong. I mean, but you and I probably be the same. Like once a year, I'll have a patient leave my office, and my office will tell you, I get annoyed for days.
Yeah.
And like, let it go. She's not worth it. But why did she leave the practice?
But why? So why do you care? Like
I care because it's one patient.
Yeah.
I'm trying to figure out what could I have done differently.
Exactly.
And I know I can't please everyone.
Yeah, but you want to please
But
everybody.
I take it, like, gee, what the heck?
Yeah.
What?
Yeah. I had a colleague at one point said, my patients, they can wait for me an hour and a half, because when I go to my doctor, I wait that long too. And I think that's bogus.
See,
That's
is
bogus. That's the wrong approach.
Yeah.
I want to be waiting for my patients. I want my patients, when they do wait 10, 15, 20 minutes possibly, that's the anomaly. That's not the rule, And
I even have my staff make sure my 2 bathrooms, like the sink is dry, bathroom is clean. So I have them go in there many times a day, make sure it's spotless. Because if the bathroom, for this woman's health, I want to make sure they understand the bathroom is not only attractive but clean. The sink is dry. I want them to know, wow, this office pays attention.
Exactly.
The little things like
the
that.
little things because we all hopefully, right? You're rating some physicians, right? We hopefully are all well trained, and we hopefully know what we're doing. But where you can stand out or make a big difference are these little things,
Little things, but there are, like you don't have to go into a men's locker to change into scrubs and be surgery, because you don't do that.
I just rip off my sweats.
Yeah. Can you believe there are surgeons who throw scrubs onto the floor? And I said, like, what the?
Yep.
If I see a person like that alone is enough that I will never refer patient to that doctor.
I was one time in a newborn nursery at a community hospital, and I was examining a baby. I turned to the nurse and said, "Oh, can I borrow a diaper?" And she says, "Why do you need a diaper?" I said, "Well, the baby pooped. I'm going to change it." She goes, "The other docs don't change diapers here." I'm like, "Well, they should."
They should.
Like, really? I'm going to put this diaper back on the baby and then you change it? Come on.
Yeah.
Like in the office, if there's something in the diaper, I always will change it for the parent, because that's bad practice.
I think especially now, patients are becoming more sophisticated, but what they're really looking for is very simple. They want to be heard, and they want to be spoken to like a normal person. But I find, at least in my field, the majority don't have that skill, trade, or interest, which is what makes them poor clinician.
But my thing is, like, why? Like, if I didn't worry about being on time to patients, not making them wait, I think, not that I'm distracted. I'm not distracted by that, but that stresses me out. Like I think half my day stress would go away. Like, what makes us or other doctors care? Like, why does it bother us? Right? Why are we so?
I think for
why
some,
are we so aware of this?
Because for some of us, we are decent people, and if I'm starting, I want to make sure I start on time, and I book my patients so that I'm not running late. There may be here and there, but I want to make sure I respect their time, because their time is as important as mine.
100%.
Yep.
So
I'm not like airline where I don't overbook and say, hey, for those of you who reschedule, there'll be a, Dunkin' Donut gift card or something. I don't do that.